Hello, and it is Shankar and Dr. Roger on this wonderful Wednesday, April 13th. Yes, we are indeed live. This is not a recording, right, Dr. Roger?
Right, we're live.
We are live, and it helps so much to have you as a doctor explain some of those concepts that are so impactful to healthcare and also its cost. And what is really, really startling to me is that these very basic terms are actually not basic and not easily understood. So the first question I have for you today, Dr. Roger, is we have these terms emergency care, urgent care, and then there's primary care. What are the differences?
All right, very good. Well, I'm happy to be here and visit about this. I'm all about access to care, in improving access to care, and strengthening the doctor-patient relationship, and helping people get the right access and have access. So, a lot of times, let me step back a minute. Primary care, that's the routine medical care that you have. Primary means first, and usually that means or connotates you go to your doctor. That's for the things that can be handled without a higher level of care, like without a CAT scan or um, you know that kind of stuff that'll be done in a hospital or an emergency room. So, so primary care is management of your chronic medical conditions or simple acute needs that are medical that need to be handled by a doctor. And I believe we're going to have some slides that will show a lot of those kind of things. So urgent care and emergency care, uh, we could think of as a higher level of care after primary care. Okay.
Mm-hmm. So that is very interesting. It appears to me that there is, as a patient, as a consumer, there is a certain knowledge that would be ideal to have to decide where to go when you don't feel well. To do you feel that the public, the typical American, knows how to discern between these situations?
Well, Shankar, you frame it in an interesting light because what you said is you feel like the American public should have an idea of when they should choose one or the other, right?
Mm-hmm.
And so now I think that that kind of mindset that you're coming from, that perspective has evolved because most folks don't have access to a primary care doctor or their own doctor. Um, you know, Back in the day, like in the day of my parents, your parents, folks could call the doctor, their doctor, which they've had a relationship with, and they could say, "Hey, this is going on. Do I need to come in to see you, or do I need to go to the emergency room?" Well, obviously, if somebody's bleeding out or their bone is sticking out of their skin, or obviously, they know they don't have to talk to
Mm-hmm.
their primary care doctor, their doctor. They're just going to go to the emergency room. Okay, if they're in a car accident or something like that. But for most acute conditions, like a simple cut, like sinusitis, sore throat, a cough, urinary tract infection. Oh, I sprained my back. Those kind of things in the past, you know, a person could have access to their doctor, and their doctor would tell them on the phone, "Hey, well, I'm going to call this in for you," or "No, let me come in and examine you, and I got to, see if it's this or that." So, I think that to answer your question, I think that um, that mindset or that you framed your question in comes from the fact that most of the time these days, in this day and age, folks don't have access to their primary care doctor to know if this condition needs to be treated in an urgent care or an emergency room.
Mm-hmm. Yeah, that makes a lot of sense. I mean, how would they know? It's not nothing they have studied, and so that
And
leaves
so let me just add to that.
right.
And now another thing that kind of adds to that mindset, or that kind of grows into that thinking, is the concept of a high deductible health plan. You know, initially I was a fan of those because it was an attempt to control the high cost of healthcare. But the more I learn about them, and the more I've seen how they can kind of work against a patient, they limit access to a patient, because that having a high deductible plan or an HSA makes puts a person in that mindset, like, well, I'm going to see if I can wait this one out, or I think it's a cold, or I think this back pain is nothing, and so they'll avoid care. And if it's not something like a self-limited medical condition, it'll get worse, and then they're going to have to go to the emergency room. They might they might need to go to emergency room. They might need to be admitted to the hospital, or even worse. So
Mhm.
okay.
Yeah, so that's a good point, and a lot of people are in a vicious circle, if you will, because they have high deductibles, and then they can go for one-off visit, but then they have also that copay, and the copay very often is so high, still high, that prevents them from actually seeing the doctor, and that
Right.
is very sad. It's like a vicious circle where they can't break out of.
Hmm.
And so, I mean, it sounds to me like having access to a primary care doc is the solution to a lot of this problem that we are talking about here.
Yes.
Um, by the way, you will dive deeper into how this knowledge impacts companies and how they can control cost, healthcare costs. So, if we have any business owners watching, they should definitely go to the link that is in the banner, in the ticker below, and sign up for that. That happens on May 3rd.
Right.
But another question that I have is, whenever you go somewhere, you always have to ask yourself, well, what is the motivation of this place? What drives their decisions, and what drives what they're saying, right? Because if you go to your independent primary doctor, that person has a different motivation than maybe your urgent care at the corner. Would you agree with that?
Well, I think you're kind of taking a look under the hood of healthcare
Mm-hmm.
to see what the motivation is.
Mm-hmm.
Docs, especially primary care docs. I don't want to step on any toes of my colleagues, but primary care docs, for the most part, know their patients, and they have their best interest in heart, and they they are sensitive to all of their healthcare needs. Um, that As opposed to what just the acute need might be, if someone shows up in a emergency room or urgent care clinic.
Makes sense. Okay. Well, let's take a look here, a closer look at this slide that we have here. And basically, it lists the 9 most common emergency room visits.
Mm,
You are the doctor. What's your comment? What do you think about this list?
yeah, well, what I think about that is it's amazing to think that all of these 9 most common things listed for emergency room visits are not emergencies, really. I mean, so an ear raid, yeah, that could be very painful, sore throat, strep, but they're not really emergencies, like life threatening. And pretty much all of these things can be seen and treated by a primary care doctor in the office. They don't need a higher level of care, like the equipment that you would find in an emergency room. Okay,
Yeah.
so that's kind of striking to me, and it makes me think of why, and it
Mhm.
comes back to this thing that we're always talking about is having access to your doctor. I mean,
Mhm.
affordable access, and then if you're an employer and you're trying to provide health care for your employees, how much is that costing you?
Mhm.
And that's a little bit more about what we're going to talk about on May 3rd. So if you're an employer or just want to know more about how to control the high cost of healthcare, I hope you'll tune in to that.
Yeah, definitely.
Mhm.
That's going to be a private Zoom link, so you have to RSVP and show up in order to get that valuable information. Okay, well, let's look at the costs of a few of those things, because there's a striking difference between what you pay, for instance, the first line here, allergies intervention, when you go to the emergency room versus urgent care.
Mm-hmm. Right. Quite a difference in the cost in
Hmm.
emergency room and urgent care, um, and with all of them as well. And I might just if you look at the right hand column, it's Direct Med Clinic, and that doesn't cost our patients anything extra, and it's because of the direct primary care model that we have here. And we'll talk about that a little bit more on May 3rd and how employers can take advantage of that and how we helped an employer save almost $1 million by using that model.
Yeah, I mean, this is you telling me that we have something. Okay, let me bring this up again because this is crazy. We have something, acute bronchitis, that is listed at 595 in the emergency room, and then we have 127 for urgent care, and $0 at Direct Med Clinic. I mean, this is a no-brainer for any business owner, that if you deal with such differences, you can save a lot of money, because it's not just one person; it's all your workforce, and then there's repetitive occurrences, of course, and of course, then there is the human aspect of actually providing affordable and accessible care that people will use. I mean, how this works is really beyond me, and I can, it's almost too good to believe, but it is not. But how that works and why that works, that you will explain on May 3rd.
Right. We come across that question all the time. Like, what's the catch? This looks like too good to be true. We had someone in our clinic today, and we explained this model, and she was like, "Well, what's the catch?" Or, "It sounds too good to be true." So we
Yeah.
hear that all the time. So it's a thing. It's really good.
Yep, and again, link.directmedclinic.com/employers. That's where you need to go right now and RSVP, so you can know the secret of how you can push that down to $0.
That's just, for an employer, yeah, it could make a big difference. But, even for an individual, if you don't know about direct primary care, log on at that time anyway and learn a little bit more about it,
Mhm.
because the savings are real. The affordable access to healthcare is real. And we have a wonderful team that provides that, and we love doing it.
Yeah, absolutely. I mean, you brought it up now. You are offering that not only to companies but also individuals. So
Yes,
it's
yes,
really something that anyone can take advantage of
sure.
if they are open to it. And why wouldn't you? If you understand it, it's not too good to be true. It's just the way you structure your healthcare delivery model, which you are an expert in that.
Right.
Okay, well, let me bring up this last slide here, which really just shows a nice visual and makes a bold claim. $1 million, Roger? 3 ways?
Yes, that's what we're going to talk about.
Awesome.
Some 3 basic principles or concepts that are that we follow to help this employer save close to $1 million.
Okay, well, if this is not worth your time, then I don't know what is. Okay, well, I will get us wrapped up here. I know we have a live scheduled. Is it tomorrow?
Yes.
Yes. Okay. So definitely follow this account and make sure if you see the little bell on LinkedIn that gives you the notifications when Dr. Roger goes live. I think it is a cost-saving bell, y'all. You can click that bell. Okay, well, thank you, Dr. Roger Mochigemba, for your time, and we'll see everyone again tomorrow. And for now, we'll wrap it up. Bye-bye.
Bye.